please.
So good afternoon, everyone. I'm going to present my study on Dacryocystosclerotherapy as an alternative to DCT in patients not compliant to surgery. So as we know, dacryocystitis is inflammation of the lacrimal sac that typically occurs in patients with nasolacrimal duct obstruction. Prompt treatment is required as dacryocystitis can lead to life-threatening conditions. Systemic antibiotics is the first treatment for acute dacryocystitis, and refractive cases require lacrimal sac massage, lacrimal irrigation, and surgery like DCR or DCT. The patients with dacryocystitis and severe systemic or ocular comorbidities and or refusal for a DCR or DCT require an alternative. So sclerotherapy is a non-surgical procedure where sclerosins are injected into the lesion. The common sclerosing agents used are ethanolamine oleate, sodium tetradecyl sulfate, and bleomycin. It has been studied that for eyelid and orbital vascular and non-vascular lesions with good outcomes. The use of dacryocystosclerotherapy for lacrimal sacs was reported by Vasilakis et al. And Ali et al. Before. So the aim of this study was to introduce a less invasive therapeutic method in selected patients with primary NLDO and to evaluate the role of DCST as an alternative to DCT in a specific group of patients. So it was a prospective non-randomized interventional study conducted between September 22 to February 24. The cases with chronic dacryocystitis with primary NLDO having severe systemic and ocular comorbidities and or refusal for a dacryocystictomy were included in this study. Lyophilized bleomycin, that is, bleomycin activity with 1 unit per ml was used as a sclerosing agent for a DCST. Following punctal dilatation, the sclerosant agent was injected into the lacrimal sac very slowly and stopped immediately when there was a regurgitation from the opposite punctum. So the patients were reviewed in the next day and at 1 week. The need for topical lubricants, if any, was decided the next day. At 1 week, if there was any residual discharge or regurgitation, the injection was repeated. And the collected data included demographics, duration of nasolacrimal duct obstruction, ocular and systemic comorbidities, type and volume of sclerosant agent used, post-injection events, use of oral steroids, and extent of DCST. So in the results, we had 9 patients in the study, 7 were females and 2 were males with mean age of 68.2 years. The mean duration of chronic dacryocystitis was 1.4 years. The mean dose of bleomycin used was 0.31 cc. None of the patients complained of any severe pain during the injection process. 3 patients had mild conjunctival hyperemia, which resolved with topical steroids and lubricants for a week. 1 patient had ocular discomfort, which was asymptomatic after a week of lubricant use. No patient had any evidence of corneal epithelial erosions. At 4 weeks post-injection, none of the patients had any discharge or regurgitation. So after a mean follow-up of a period of 18 months, lacrimal pathway was permanently obliterated in 6 cases. 2 patients needed a repeat injection. 1 case, the patient refused to repeat the procedure after the initial failure. So this was a case with dry chronic dacryocystitis for 2 years who had a history of cardiovascular disorder, and that's why she refused the surgery. Injection bleomycin was given in the lower puncta, and after 1 year follow-up, we can see there was no regurgitation or discharge. This was another case with left-eyed chronic dacryocystitis who denied the surgery, and after 6 months, there was no discharge or regurgitation. So as we know, the current study examined the role of dacryocystosclerotherapy with bleomycin as an alternative to dacryocystictomy. So bleomycin is a cytotoxic antibiotic and has antineoplastic properties. It acts by inhibiting the DNA synthesis. When used intravascularly, it can cause endothelial damage, non-specific inflammation, and subsequent occlusion. It has a low cost and easy availability. In our study, bleomycin was used as sclerosing agent as it was the easiest and cheapest available option. After a mean follow-up period of 18 months, the lacrimal pathway was permanently obliterated in 6 cases. Similar study was done by Vasilakis et al., who used 5% ethanolamine oleate. Ali et al. Used STS and bleomycin and studied the histopathological features. Lai et al. Has used injection doxycycline in an 89-year-old woman, and he also had some effective result after this. So the limitation of our study was comparison with other sclerosing drugs would have been beneficial. A larger sample size and a longer duration of study was required. To conclude, in patients non-compliant to surgery, bleomycin dacryocystosclerotherapy appears to offer a simple, low-cost, and less invasive alternative to dacryocystictomy. Thank you. Ma'am, we didn't.
against DCR?
Ma'am, those patients who had chronic dacryocystosclerosis, who had recurrent episodes of acute dacryocystitis, and they had refused surgery. Like either they had a failed dacryocystectomy, or one of the patients, she was aphakic and was scared of surgery, and the other patients, they had a severe cardiovascular disease history. They didn't want to undergo surgery. That's why we were looking for an alternative.
No. My question was, why did you choose DCT over DCR for these patients? You
Oh,
said
we
you
don't
advised
DCR at
DCT.
our center, ma'am. That's
Okay.
why.
Okay. And what's the dosage? You said 0.3. What is the dosage of bleomycin?
It was 1.2 cc.
1 milligram per ml, you said.
So not
No,
doing
ma'am.
The amount.
The amount was 0.2 cc and the doses were 1 unit per ml.
Yeah.
not doing DCR and then just going for DCT in young patient is not a right alternative.
Yes, ma'am. We didn't have those young patients, like late
Another
middle-aged
thing,
patients were there.
you decided to inject the bleomycin through the punctum.
Yes, ma'am.
We could have gone directly into the sac also. Sclerose to sac ko hi karna tha. Why did you want to sclerose the entire lacrimal
Any
passage?
complication? That was my next question. Any complication of the punctal stenosis?
Punctal stenosis. Why are you
We didn't
disturbing
find
the
those, ma'am.
punctum and canaliculi? What purpose is it solving?
We injected it, like we reached the sac only via punctal.
But it is a sclerosing agent. Wherever it will go, it will cause sclerosis, it will cause inflammation. So why are you destroying the punctum and the canalicula? You can directly go into the sac also, if that is the purpose.
Or use the upper punctum then.
Okay.
Let us try.
You just mentioned one. Are you
Is
from
there any
Actually,
evidence of epiphora after this? Complication? Maybe epiphora?
So the patient, regurgitation was not there, and the patient didn't complain of epiphora. They were happy that discharge was not there. We didn't find epiphora, sir.
It is very unlikely.
But scientifically, how do you explain it?
I think it was like a bias only. Like patients were happy that discharge was not there. They didn't complain of epiphora.
So
It
just
needs more study, in fact.
Yes,
9
ma'am.
patients are too
Very
less,
few
and
cases were there.
we just can't go by this, that we can also start
sir.
injecting bleomycin into our patients instead of doing DCR.
so just
That would be wrong.
one question. Are you from a institute?
No, sir.
Are you a practitioner?
Sir, I did my PG and I'm serving bond. That's why we don't have DCR facilities and other stuff.
No,
Like,
DCR is a basic one.
Yes,
DCR,
sir.
DCT, that's not a wrong thing. Everyone, once someone cross DO, DNB or MS, is not a good one to say in our setup there is a no, because a basic,
Yes, sir.
because we don't want to do. We want to love the cataract phaco sucraless, that's the reason. Otherwise, is a relatively easy surgery than in SICS. But that is not the way. And the criteria to inclusion criteria is not that one. You are injecting bleomycin in one case where there is a acute dacryocystitis.
No, sir. Those are chronic cases. Like they were having recurrent episodes.
Recurrent means
Like
recurrence in chronic. There's a recurrent dacryocystitis. What is recurrent dacryocystitis?
Like they were having repeating episodes of like acute inflammation.
That chronic and recurrent. There is a huge difference is there. That is recurrent means what?
So, like
In which case you can label it as a recurrent dacryocystitis.
so repetitive episodes, like within
That if there is a more episode, then is not a chronic one. Okay.